An infant was brought to the PHC for immunization. He was vaccinated by the nurse who reconstituted the vaccine with the sterile water, who diluted the vaccine with the sterile water before administration. Which among the following vaccine the nurse has likely administered? Okay, vaccines are always an important, guys. Which of the following vaccines? Yes, distilled water directly from the notes, from the distilled water. Which vaccine, guys? Which vaccine? Very good. It is MR. Which vaccine you dilute with the sterile water, guys? It's MR. So let's write diluents of vaccine. Okay. Let's write diluents of vaccine. Guys, vaccine, two questions will come. Okay. One is universal immunization schedule, guys. Okay. Schedule se aayega kaun sa vaccine kab dena hai, like birth, which vaccine you have to give at 6 months, at 9 months. Okay. Then 15 years, 10 years, boosters. One question from there, and one question possibly from the diluents or strains or other adverse effects. So I've mentioned everything, guys. I'll discuss right now the diluents. Then in the next question, we'll discuss the adverse effect of particular vaccines, then the strains of a particular vaccines. Is that clear? So guys, if I talk about diluents of the vaccine, guys, normal saline is a diluent for which vaccine, guys? BCG vaccine, yellow fever, and dengue. Okay, these are the diluents of the vaccine. Normal saline is a diluent for which vaccine? BCG vaccine, yellow fever vaccine, and dengue vaccine. If I talk about at birth, what are the vaccines you give, guys? At birth, what are the vaccines you give? Bob, है ना? Hepatitis B, OPV, and BCG. So BCG is given at birth. 2022 June. Out of which of the following vaccine is given at the time of birth? Direct question, the BCG. Can you tell me the adverse effect of BCG vaccine? Can you tell me the adverse effect of BCG vaccine? Miliary TB. Adverse effect kya hai, guys? Miliary TB. Can you tell me the dose? It's 0.1 ml. Kitna dete hai, guys? 0.1 ml. 0.1 ml. Okay. So if I talk about one more, Japanese encephalitis. If I talk about Japanese encephalitis diluent, we have phosphate saline buffer. We have phosphate saline buffer. So for Japanese encephalitis, what do we have? Phosphate saline buffer. Is that clear? For Japanese encephalitis, what do we have? Phosphate saline buffer. Then the strains of Japanese encephalitis virus we're going to discuss, guys. Nakayama SA14442, what is for the killed and live one. Okay. Then distilled water. You already know, guys. Distilled water. MR. Okay. Then, guys, vaccines that are available in the liquid form does not need a diluent. Okay. Vaccines available in liquid form, that means they don't need a diluent. What are the vaccines? Anyone? What are the vaccines that are available, guys? Hepatitis B, TT, and DPT. Okay, guys. And diphtheria, pertussis, and tetanus. Okay, and TT. Okay. Now for tetanus, guys, in the pregnancy, I've told you, when is the first dose in the pregnancy you will give? When is the first dose? You can give in the first trimester. Okay, guys. And when is the second dose? Second dose, 3 weeks prior to the delivery, you can give. Is that okay? And now, if she is a primary gravida, then how many doses? 2 doses. But if she is a multi-gravida, and the last childbirth is less than 3 years, then 1 dose. If more than 3 years, then 2 doses. Is that clear? And minimum gap between the 2 vaccines should be 4 weeks. The minimum gap between the 2 vaccines should be how much, guys? It should be 4 weeks. Is that clear? Is that clear, guys? So that was all about this. Now, if I talk about DPT, Hep B, measles, MMR, or Japanese encephalitis, you give how much, guys? 0.5 ml. How much to give? 0.5 ml. OPV kitna dete, guys? 2 drops. That's around 0.1 ml. Is that okay? And rota vaccine, 5 drops. Okay, around 0.25 ml. Is that clear? Is that clear? Okay, guys, that is all about the vaccination. And for the pregnancy, guys, pregnancy se question aa sakta hai from the pregnancy, guys. What is the vaccination schedule for the tetanus? Is that clear? Yes. Nasal route, live influenza through the nasal route. Okay, let's move to the next question. A child on examination has a finding given in an image below. It belongs to the WHO class. What is the class it belongs to? Okay, it's Bitot X1 B. It's Bitot spot X1 B. Okay, what is your probable diagnosis, guys? Bitot spot. Guys, vitamins are very important. All the vitamins are very important. Okay, all the vitamins are very important. Let's recall the vitamins fast. Okay, सबसे जल्दी से vitamins को recall करते हैं. Okay, be fast. I will not sir, green line remove कर दीजिए. It's not from my side. It's you students who mark this green line. Please, anyone who marked the green line on the screen, just remove it. Whosoever did it, just remove these lines, please. It's difficult to the other students. Okay, so guys, Bitot spot. Okay, let's revise all the vitamins. Okay, vitamin A deficiency, it's already clear, guys. Night blindness and conjunctival xerosis. Okay, let's start with the B, guys. Vitamin B1. Okay, vitamin B1 is thiamine. Very good. Thiamine deficiency causes beriberi. Thiamine deficiency causes beriberi. Okay, in case of alcoholics, it causes Wernicke's encephalopathy and Korsakoff's psychosis. Wernicke's encephalopathy and Korsakoff's psychosis. Okay, what is the difference? How do you differentiate these two, guys? How do you differentiate these two? Okay, you remember the three things. GOA. Okay, global confusion. Okay, ophthalmoplegia and ataxia. They are seen in which condition? GOA. तीन condition किसमें दिखेंगे हमें? Wernicke's encephalopathy. Very good. And Korsakoff psychosis will have what, guys? Confabulation and retrograde amnesia. Okay, these are the classical findings of the Korsakoff psychosis and GOA in case of a Wernicke's encephalopathy. What will be your treatment, guys? IV thiamine. What will be your treatment? IV thiamine. Okay, then vitamin B2. Vitamin B2 is riboflavin. The deficiency will have chiliosis, glossitis, है ना? Angular stomatitis. Very good. These are all seen in the deficiency of a vitamin B2. These are all vitamin B2. Then vitamin B3 is niacin. Vitamin B3 is niacin. Niacin deficiency causes pellagra. Niacin deficiency causes pellagra. In pellagra, you remember 4 Ds: dementia, diarrhea, death, and dermatitis. Are you getting my point? Dementia, dermatitis, death, and diarrhea. Okay, now niacin comes from which amino acid? We have discussed it multiple times. It comes from which amino acid? Tryptophan. Very good. Tryptophan. It comes from the tryptophan. So if they give the cassal neck appearance of the pellagra, okay, pellagra like symptoms, the dermatitis, okay, if they will mention which amino acid is deficient, so we can also write tryptophan deficiency, because if the tryptophan is deficient, niacin is deficient. Is that clear? Is that clear? Then vitamin B5. Vitamin B5 will cause which deficiency? Due to the vitamin B5 deficiency, pantothenic, yes, burning feet syndrome. B7 is biotin. Okay, guys, B7 is biotin. B6, pyridoxine, mainly due to the intake of isoniazid. Okay, that's why we prescribe what? Pyridoxine in case of a TB patients. Is that okay? Then B9 is a folic acid, already discussed, guys. It causes megaloblastic anemia and neural tube defects. Then also megaloblastic anemia is caused by which vitamin? It's caused by vitamin B12. But the vitamin B12 helps in the myelin sheath of the neurons. Okay, so if there is a deficiency of vitamin B12, patient is more towards to the neurological features. Is that okay? Then, guys, vitamin D in children causes rickets, and in adults causes osteomalacia. It causes osteomalacia. Vitamin E causes hemolytic disease in newborn. Okay, guys, hemolytic disease in newborn, है ना? And vitamin K deficiency will cause hemorrhagic disease of newborn, है ना? Vitamin K will cause hemorrhagic disease in newborn. That is all about vitamins. Vitamin C deficiency will cause scurvy. It will cause delayed wound healing. And one more MCQ, it helps in the iron absorption. Anything else in vitamins, guys? Nothing else is there in vitamins. This is all you have to remember for the vitamins. Okay, there can be a classical cases. Just go through those cases. Okay, deficiency, vitamins are very, very important. But vitamin A is very important. Every time vitamin A questions will come. Who is this MK? You are drawing the lines. MK, whosoever you are. Either just don't do that or I'll throw you out of the class. Don't do that. Okay? Is that okay? Please remove these lines. Don't disturb the class. Is that okay? Vitamins are clear, guys? All clear? Vitamins? Yes? Yes, a zinc deficiency. Yes, zinc deficiency will cause acrodermatitis enteropathica. Zinc deficiency will cause acrodermatitis enteropathica. Acrodermatitis enteropathica. Okay? Okay, anything else, guys? Selenium deficiency will cause copper deficiency will cause Menkes disease. Okay, in Menkes disease, copper deficiency. Okay, Menkes disease. The patient will have what? The patient will have kinky hair and mental retardation. Patient will have kinky hair and mental retardation. Okay, in case of a kinky hair and mental, what is the gene defected in Menkes? Menkes में कौन सा gene है, guys? ATP7A. Very good. If I talk about Wilson disease, it's ATP7B. It's ATP7B. In Wilson disease, which cataract you have, my dear students? You have sunflower cataract. You have which cataract? You have sunflower cataract. There is a copper deposition in the which membrane? Basement membrane. Copper deposition in the which membrane? Basement membrane, and there are the rings called as KF rings. Just remember, guys, KF rings. Okay, what is the treatment, guys? You give copper chelators, you give penicillamine, in Wilson disease. You also give what? Zinc in the Wilson disease. Okay, that is due to the increased copper. Okay, if there is a decreased copper, guys, that is Menkes disease. The patient will have a kinky hair. क्या होगा patient को? Kinky hair. Along with that, patient will have a mental retardation. So kinky hair, mental retardation is a feature of Menkes disease. Then ATP7A hair and B hair. Wilson is again the favorite question, guys. So cataract. So tell us about other cataracts. Okay, other cataracts, you remember, be fast, guys. Otherwise, I'll go. Other cataracts, you have which cataract? You have snowflake cataract. Snowflake cataract, which condition, guys? Diabetes mellitus. Okay, guys. You have oil drop cataract. Which condition? Galactosemia. Galactosemia. In snowflake cataract, that is in the diabetes, my dear students. Remember that the cataract that is in the diabetes. Okay, there is an accumulation of the sorbitol. Once there is an accumulation of the sorbitol in an eye, guys, there are hazy white opacities. That is due to which cataract is developed. And what is the treatment, guys? Lower down the sugar levels. Along with that, phacoemulsification you can go for. Phacoemulsification. Okay? That is for galactosemia, there is an accumulation of the galcetrol. Okay? And it is a reversible cataract. कौन सा cataract है? It is a reversible cataract. Okay? If you have a blunt trauma में कौन सा cataract है? Rosette shaped cataract. In blunt trauma, which cataract do you have? Rosette shaped cataract. Okay. In myotonic dystrophy, which trinucleotide is repeated? CTG. कौन सा cataract है? Christmas tree cataract. Which cataract, guys? Christmas tree cataract. So these are all the important cataracts. Okay, they will give you the clinical case of a particular findings, and you have to just mark the cataract accordingly. Okay, out of which of the following is a reversible, guys? Oil drop cataract, है ना? Galactosemia. That is the galactosemia as a contraindication for lactation. ये भी क्वेश्चन आया था. Okay, what is an enzyme deficient in galactosemia? कौन सा enzyme deficient है galactosemia में? कौन सा enzyme deficient है galactosemia में? Just tell me. Which enzyme is deficient in galactosemia? Galput. Very good, very good, very good. So guys, this was all about the cataracts. Sorry, this was all about cataracts and the deficiency. Selenium deficiency. Selenium deficiency will cause? Selenium deficiency will cause Cation's cardiomyopathy. है ना guys? है ना? Cation's cardiomyopathy. Anything else, guys? All vitamins and all important things are already discussed here. Okay, let's still check from our workbook, guys. Let me see in case we left anything, guys, because vitamins and this all are very, very important. Okay, they are all very, very important. Okay, I don't want to miss anything. Let's still check it out. Can anyone tell me the vitamins page number? Okay, it's here. Okay, vitamin, we already discussed B1, guys. Let me discuss this. We already discussed deficiency beriberi, vernix, encephalopathy, and Korsakoff psychosis. Okay, prevention, parboiling of the rice. Okay, then B3 is niacin, causes pellagra. 4Ds already, casal neck, guys. This is the appearance of the casal neck. Stomatites, angular stomatites, guys. This is beriberi picture. Then deficiency of pantothenic acid will cause burning fit syndrome. Pyridoxine, it causes peripheral neurites, and due to the ATT drug, isoniazid, guys. B7 is biotin and it causes hair loss. Hai na? Then in dermatology, we have already discussed about the hair losses, guys. Hai na? 3 phases. Okay, if there is a hair disorders due to the typhoid, okay, what is the answer? Due to the typhoid, if you have a hair disorder, what will be the answer, guys? Telogen. है ना? Telogen, है ना? Due to the chemoprophylactic drugs, due to the pregnancy and all, you have discussed that. Then alopecia areata, you have no patchy hair loss with the exclamatory sign in there. What will be your drug of choice, guys? Minoxidil will be 2% in the females and 5% will be in the males. Along with that, we give dihydrofolic reductase inhibitors. Okay, what are the drugs? Finasteride, है ना? That is in the hair loss. Then folic acid, I've already discussed megaloblastic anemia, neural tube defects. B12 also causes megaloblastic anemia, and it's mainly found in vegetarian diet. Okay, so neurological features will be associated. This is spina bifida, guys. Okay, which sign we have in spina bifida? Banana sign and lemon sign. Just remember the signs. Vitamin C will cause scurvy, guys. Okay, classical picture. And the vitamin D deficiency in children causes rickets, and in adults causes osteomalacia. Okay, vitamin E will cause hemolytic disease in newborn, and vitamin K will cause hemorrhagic disease in newborn. Okay, these two things you have to remember. Okay, that was all about vitamins. Okay, so let's get back to our lecture. So it was the vitamin A deficiency having a bite spot. Now WHO classification, the WHO classification for this is, guys, primary signs. For X1A, let's remember these. X1A is for which, guys? Which sign? X1A is for conjunctival xerosis. X1A is for conjunctival xerosis. X1A is for conjunctival xerosis. Then X1B is already, guys, bite spots. Okay, if I talk about X2, that is corneal xerosis. That's corneal xerosis. X2 is corneal xerosis. X3A is corneal ulcer. X3A is corneal ulcer. Okay, X3A is corneal ulcer or corneal scar. Is that okay? Okay, so deficiency of vitamin A causes xerophthalmia. Then WHO have this X is xerophthalmia. So WHO has the primary signs that we are going to discuss, guys. X2 for corneal xerosis, X3A for corneal scar or ulcer, X3B for keratomalacia. For keratomalacia. These are all the primary signs. Ye kya hai, guys? These are all what signs? Primary signs. These are all primary signs. But for the secondary features, if I talk about secondary features, for secondary features, guys, N for night blindness, N for night blindness, XF for xerophthalmia fundus, xerophthalmic fundus, and XS for xerophthalmic scar, XX for xerophthalmic, XS for xerophthalmic scar. Is that clear, guys? Is that clear? And already, what is the first symptom? First symptom will be night blindness, and the first sign, if I talk about first symptom again, what will be the first symptom? Night blindness, and the first sign will be conjunctival xerosis. But the most common clinical sign will be bite spot. Most common clinical sign will be bite spots. Then already discussed, guys, vitamin A dosage. If less than 6 months, 50,000. If up till 1 year, 1 lakh. More than 1 year, 2 lakh. But if the weight of the baby is less than 8 kg, then again 1 lakh international units. Okay, total 9 doses. Total amount is 17 lakh international unit. Is that clear? Is that clear, guys? Everyone? Clear? Clear all the vitamins? Anyone, any doubt from the vitamins that I've discussed, guys? You don't have to go deeper into the vitamins. Just remember the names and the deficiencies. Main deficiency याद रखो. ठीक है? Remember the main deficiency. Is that clear? Okay. Sir, what is the folic acid dosage? Folic acid dosage I've told 0.4 mg. You have to give daily. Okay. But if she has a history of neural tube defect, that is 4 mg. Okay. Now, if I had to write this in micrograms, what I will write? 400 micrograms and 4000 micrograms. Okay. Is that clear? Is that clear? Okay. They can change the values. So rather you will find 0.4 and 4. Remember the micrograms. Itna math to aata hi hoga. Now, maize is deficient in which of the following amino acid? Maize is deficient in which of the following amino acid? And I have told you the formulas PCM, MLT. Do you remember, guys? Yeah, so what is the answer? A, B, C, D. I will repeat that again. So tell me what is the answer for this one? Prabita, tryptophan, Reshma, B, iPhone, V. What are the different names you have? Serotonin, melatonin, vitamin B3 or tryptophan. Yes, yes. No. What is the answer? The answer is both A and B. The answer is both A and B. The answer is both A and B. Do you remember, guys? I told you MLT. How many of you remember from the classes? MLT bola tha maine wahan pe. Let me show you guys MLT directly. MLT. If it is there. है ना? Mazes are deficient in tryptophan as well as lysine. Okay, let me write it here, as well as lysine. Okay, remember it, guys. Okay, yes, leucine is palindrogenic. Yes, I will remember that. Okay, CLT, you remember, guys? Cereals are deficient in lysine and threonine, and pulses are deficient in methionine and cysteine. Okay, methionine and cysteine. So let's discuss this there. Okay, principal food. If I talk about cereals, okay, cereals are deficient generally in the lysine. Okay, if I talk about maize, okay, it's lysine and tryptophan. Okay, if I talk about wheat, okay, it is lysine and threonine. These are the PYQs, guys. And the last one, pulses. PCM ko yaad rakhoge. That is cysteine and methionine. That is cysteine and methionine. Is that clear? Okay, guys. Done. Okay. Even remember one point, guys. It might be useful. Excess of maize. Okay, if a patient is taking excessive maize, okay, in maize, what do we have? Lysine. Sorry, in maize are rich in leucine but deficient in the lysine. Okay, this leucine can interfere into the niacin production. Okay, this leucine can interfere with the what, guys? Niacin production. Okay, then this niacin will be deficient. So can I say excess of maize? while interfering in the niacin production can also cause pellagra. Okay. In case the twisted question will come. Remember, guys, leucine is more in maize, and this leucine interferes with the production of the niacin via tryptophan. And if there is a patient who is taking a excessive maize, so there can also be the pellagra deficiency. How? Due to the interference of the niacin production. Are you getting my point? Okay. So guys, just remember 60 mg of tryptophan, 60 mg of tryptophan, 60 mg of tryptophan are required to produce 1 mg of niacin. Is that clear? That is a extra point. Okay, that is an extra point. Remember that. Okay, even jowar, excessive of jowar, sorghum that you call, that is okay. There is excessive leucine. If there is access to leucine also, that will interfere with the production of the niacin via tryptophan, and patient can have a niacin deficiency causing a pellagra-like symptoms. Are you getting my point? Understood, guys, this concept? I mean, in case twisted question will come, enough. You just remember this much, that is enough. Okay, done. Phrenoderma. Phrenoderma is caused due to which vitamin deficiency? Phrenoderma is caused due to which vitamin deficiency? Phrenoderma. Which vitamin deficiency? Yes, A also, B complex also. What else? Essential fatty acids also, right? Hana, guys? Okay, mainly you will remember essential fatty acids. Okay, essential fatty acids causes essential fatty acids, है ना? उसकी वजह से फ्रेनोडर्मा होता है. Okay, then what are the essential fatty acids? Linoleic, linolenic, and DHA, है ना? DHA is used for the brain development, है ना? Linoleic, linolenic, and DHA. They are the essential fatty acids. And essential fatty acids की deficiency से क्या होगा? Phrenoderma. Okay, so what is the treatment for phrenoderma, guys? You give safflower oil. क्या दोगे, guys? Safflower oil. Image will come. Image आ सकती है exams में, and they can ask the treatment. Okay. Essential fatty acids भी हो गया, and DHA. DHA is used for brain development. Okay. Which protein is also used? Which protein is present in the mother's milk, which helps in the brain development? Which proteins that help in the brain development? Directly, guys, we have studied it. Okay. In the mother's milk, that is responsible for the brain development. What will be your answer for this question? The comparison between the mother's milk and the cow milk that we have. You guys need a hint? Hint is here. Taurine. Very good. That is also responsible for the brain development. And that's why mother's milk is important. Okay. The upper class score in Kupposwamy scale is yes, taurine and cysteine. Both are right. Taurine and cysteine. The upper class score in Kupposwamy scale is. What is your answer? Upper class ke liye? It's 26 to 29. It's 26 to 29. Okay. So let's discuss this Kupposwamy scale, guys. The modified Kupposwamy scale, that is for the measurement of socio-economic status in which areas? Urban area. Socio-economic status in urban areas. Now the three things that are in the criteria, guys, they can ask out of which of the following is not the criteria of the Kupposwamy scale. So they will be giving three things, and one option that you have to choose will be the answer. Okay, so you have to remember these three things. Education of head of the family. Education of head of family. Education of head of family. So just education, occupation, okay, and income. The total score is 29. The total score is 29. So education, occupation, and income. Question was simply asked, out of which of the following is not a component or not a criteria of a Modified Kuppaswamy scale. Education, occupation, income, and housing. What will be our answer, guys? Housing. What will be our answer? Housing. Is that clear? Now, guys, the upper class, the score of the upper class, it's 26 to 29. The score of the middle upper, it's 16 to 25. Okay. Middle lower, it's 11 to 15. Lower upper, it's 5 to 10. And lower, it's less than 5. So question was asked. What was the question, guys? Upper class score. So upper class score is what? 26 to 29. Remember the criteria, these three things, remember? Okay. So that's about a Kuppaswamy scale. Is that clear? Is that clear, guys? Everyone? Yes, sir. Okay. Next question. Which of the following committees proposed the reorientation of health education Rome scheme? Which committee is related to Rome? Which committee is related to Rome? What will be your answer, guys? Rome के related कौन सी वाली है? Everyone, all 100 students that are online, just reply in the chat box. C कहाँ से आएगा? बोर. PSM ने बोर किया. That tells us about the community medicine. You remember the tricks? PSM ने बोर किया. So what is the answer, guys? Srivastav committee. Let's discuss these all committees, guys. Let's discuss these all committees. Okay. So first health committee, guys, Boer committee. Okay. First one is the Boer committee. So PSM ne Boer kiya. So this Boer committee told us that you have to do internship in the department of PSM for how many months, guys? For 2 months. But now it's for 3 months. Okay. Just remember that the internship in the department of PSM was planned by which committee? Boer committee. Okay, guys. And it's also known as Health Survey and Developmental Committee. Health Survey and Developmental Committee. Is that clear? So rather than mentioning Board Committee, they can mention the other names. Okay, remember, guys, remember these other names. So they can play with the options. Then Mudaliar Committee, guys, it was related to All India Health Services, and it's also known as Health Survey and Planning Committee. Health Survey and Planning Committee. Okay. Then we have a Chadda Committee, guys, Malaria. Okay. Mukherjee Committee, it was giving the basic health services. Okay. Jungle Wala Committee was like, there is no private practice for the government officials. No private practice for the government officials. Equal pay for equal work and the integration of health services. Okay. Then the Kartar Singh Committee, it was like multi-purpose worker posted at the sub-center, and ANM were replaced by the multi-purpose worker female, guys. We're going to discuss, guys, these ANM, village health guide, ASHA, all these criteria in the next slides, because that is also an important. Okay. Then this Srivastav committee, guys, gave the which concept? Rome concept. Okay. So concept of this reorientation of medical education and village health guide, VHG, village health guide concept was given by which committee, guys? Srivastav committee. So simple question, guys, which of the following gave this Rome scheme? That was Srivastav committee. Is that clear? And rest all the committees we have already discussed. Is that okay? Clear, guys, everyone? Clear to everyone? Yes, can we go ahead? Can we go ahead? Okay. Yes, sir. A cardiologist, guys, is a very important one, this one, please. A cardiologist want to study the effect of an atorvastatin drug. He notes down the initial cholesterol level of the 50 patients and then administers the drug on them. Okay. After a month's treatment, he measures the cholesterol level again. Which of the following is the most appropriate to test the statistical significance of the change in the cholesterol level? So which test you will do here? Which test you will do? Which test you will do here? What is the answer, guys? What is the answer? Everyone. Okay, the answer is paired t-test. So how it is paired t-test, guys? Let's discuss. Okay, guys, let's discuss, guys. So these are the test of significance. They are called as test of significance. Now, my dear students, if you remember from the classes, guys, we have two types. Yes, before and after intervention, I will get back to everything. We have two. We have parametric, and we have non-parametric. We have parametric and we have non-parametric. The things that I will tell you to remember, just remember that much. Okay, guys. In parametric, do we have a qualitative data or a quantitative data? Do we have a qualitative data or a quantitative data? We have a quantitative data. We have a quantitative data. What do I mean by quantitative data, my dear students? Where the measurement is possible. For example, you are checking the cholesterol levels. Measurement is possible, yes or no, guys? For example, you are checking the blood pressure. Measurement is possible. You are checking the HB of the patient. Measurement is possible. This type of data is known as what? Quantitative data. This type of data is known as quantitative data where the measurement is possible. The other side, we have which data, guys? Qualitative data. We have which type of data, my dear students? We have qualitative data where measurement is not possible. Where measurement is not possible. For example, the blood group. Can you measure the blood group? You just can know the blood group, okay? Whether it is A positive, it is B positive, it's O negative, it's O positive. Are you getting my point, guys? So first you have to see whether it is a quantitative data or a qualitative data, whether it is a quantitative data or it is a qualitative data. So in parametric, we have a which type of data, guys? Quantitative data. Usually what we check here, guys, mean and standard deviation. Okay, so whenever in a question you will see that the examiner is asking about mean and standard deviation, that means you are using which type of test? Parametric or a quantitative type of test. Then I will discuss what are the tests that we have in the parametric or a quantitative data. And if it's mentioned percentage or proportion, it's about percentage or proportion, then which type of data you are talking about, guys? Qualitative data. Which type of data you are talking about? Qualitative data. Okay, now the first test that we have here is called as student t-test. What is the first test, guys? Student t-test. Okay, the student t-test is used for two groups. This used for two groups. Student t-test is used for how many groups, guys? It's used for two groups. Okay, then in the student test, either we have paired student t-test, and we have unpaired student t-test. We have unpaired student t-test. Now, my dear students, in paired t-test, what we do? We compare the same group. We compare the same group before the intervention and after the intervention. What do I mean by this statement? Let me explain. What I mean is that before this test, the initial cholesterol level of 50 patients was how much, my dear students? X. Okay, but then for a month treatment of this atrovastin drug, the month after the treatment of atrovastin drug, I am checking the same levels. I'm checking the same cholesterol levels in the same patients. Are you getting my point? Same group. Okay, so before giving the drug, the group I was studying on, after giving the drug, the group I was studying on is exactly the same. Okay, they are not different. Then which type of test is that? Paired student t-test. Are you getting my point? But if I compare two different groups, are you getting my point? Then the which type of test will be there? Unpaired student t-test. Okay, so now in this question, first of all, when I'm talking about the cholesterol, so you have to think in your mind that it is a quantitative or qualitative. It is a quantitative or qualitative? Answer me. It is a quantitative. So when you are doing a quantitative test, okay, then before the intervention and after the intervention, is the group same or different? The group is same. So you have a parametric data, you have a quantitative data. Before the intervention and after the intervention, you have a same group. Which type of test you will mark, my dear students? Paired t-test. Paired t-test. Now, if would have mentioned, then other 50 patients, okay, other 50 patients were prescribed with this drug and they were compared between these two groups, then the answer would have been unpaired. Then the answer would have been unpaired. Is that okay? Is that okay? Before the intervention and after the, did you understand this? Now the same thing, I am telling you guys, I have three groups: 50 patients group A, 50 patients group B, and 50 patients group C. When you have three groups, when you have more than two groups, okay, when you have more than two groups, the test you will do is called as ANOVA test. The test you will do is called as which test? ANOVA test. This student t-test is only for how many groups? It's for two groups. And more than two groups, what will be your answer, guys? ANOVA test. Is that clear? Is that clear, everyone? Please. So first of all, you have to remember the qualitative and the quantitative data. Qualitative and quantitative. What can be measured, what cannot be measured. Then guys, you have to see before the intervention and after the intervention, are they studying on the same group or not? If the same group is there, pair t-test. If different group is there, unpaired t-test. And if more than two groups, then directly you have to go with ANOVA test. Clear to everyone, please? Now I will give you one more question on the same scenario, guys. It will be easy for you. Blood pressure of three different groups A, B, and C was measured and mean blood pressure calculated out of it. The three means are different. The most appropriate test to determine the significance of the difference between the mean. What will be your answer, guys? What will be your answer, please, everyone? Very good. It is an ANOVA test. See, guys, the hints. Yes, B, because more than two groups. Now, you already know so far, we have already studied so far quantitative measures. Are you getting my point? Blood pressure is qualitative or quantitative? Quantitative. Very good. Quantitative. Very good. One more thing. I told you, whether you see mean or standard deviation, what are the tests you are going for? Quantitative significance test. Whether it's a pair test, is an unpaired test, or ANOVA test. See, three means are different. Okay. But if the question is mentioning percentage or the proportion, so you are going to the other test. You are going to the other test. That is what we are going to discuss: chi-square test and sign test. But so far, is this part clear, guys? Is this much of part clear? Is this much of part clear? Itna sara? This much is clear? Perfect, everyone. Guys, one question from this test will come. But I'm just telling you the easy points to grab in. Easy points. You have to check mean, standard deviation. Now, if in a question mean is mentioned, so you already know if in a question mean was mentioned, for example, there is no unpaired ANOVA paired t-test, because sorry, if in a question proportion is mentioned or the percentage is mentioned, you're already ruling them out. Hai, because you know for proportion and percentage, there is only one test, chi-square test. Yes or no? Yes. So based upon these hints, you can rule out the other options. Hai, you can rule out the other options. Is it clear, guys? Okay. Now, let me write it here. Compare the same group. Compare same group before and after intervention. But here, compare two different groups. Compare two different groups. Is that clear? This part is clear, guys? Parametric. Ab non-parametric mein. Okay, guys. In non-parametric. We have for one paired group, which test we have? Which test we have? Sign test. Which test we have? Sign test. But for more than two groups, we have chi-square test. We have which test? chi-square test. Is that clear? Is that clear? Everyone? Excellent. Thank you. Okay, guys. So you have to first see what type of the data is given. Okay. Quantitative or qualitative. Then the groups. Then are the groups same? If there are 3 groups, you directly mark ANOVA in this. Okay, it was going hard for me. I'm able to understand now. Thank you everyone. Now my question to you, atorvastatin, pharma से पूछता हूं मैं. Atorvastatin is a which class of drug? Hypolipidemics or statins? कुछ भी बता दो. What is the enzyme it inhibits? HMG CoA reductase inhibitor. है ना? Now tell me HMG CoA synthase. HMG CoA synthase किसके लिए है? HMG CoA synthase for very good. HMG CoA synthase for ketone body synthesis. Guys, remember this, HMG CoA reductase and synthase. Okay, guys? Okay, for ketone body, HMG CoA synthase, and for hypolipidemic statin में reductase. सिर्फ reductase और synthase का फर्क है. Are you getting my red और synthase का फर्क है? Okay, what are the 3 ketone bodies? Acetone, acetoacetic, and beta hydroxybutyrate. Acetone, acetoacetic, and beta hydroxybutyrate. Which among the following is the strongest ketone body? Beta hydroxybutyrate. Okay, that is why this test is also done in which case? Diabetic ketotic coma. Okay, diabetic ketoacidosis. Having which breathing? Kusumal breathing. है ना? कौन सी breathing होती है? Kusumal breathing. And fruity smell. Fruity smell is due to what? Due to these ketone bodies. Fruity smell is due to this ketone bodies, type 1 diabetes. And what is the most common cause of death in type 1 diabetes? Cerebral edema. Cerebral edema is the most common cause of death in type 1 diabetes. Is that clear? Okay, not gonna go deeper, guys. This much is clear. Done? Sir, Kusumal sign. Kusumal sign is seen in constrictive pericarditis. Constrictive pericarditis, Kusumal sign. ठीक है, Kusumal sign है ना? X and Y descent, constrictive pericarditis. Absent Y is cardiac tamponade, backstride, है ना? पढ़ा ही होगा. Is that clear, guys? Okay. The test of significance. The test of significance for 2 or more proportions. The test of significance for 2 or more proportions. कौन सा test है? When I talk about, see, I'm talking about proportion, percentage. That is qualitative or quantitative? Qualitative. More than 2. What was the answer? Chi-square test. Is that clear? Is that clear? अब आ गया समझ? All these 3 questions on the static significance of these tests. Everyone understood? I don't think more simpler than this. Okay, you solve questions on the particular thing. You explained it perfectly, sir. Thank you. Thank you, Nishant. Okay, everyone, all clear? Guys, this is a pakka question. In the end. Okay. Let's remind me in the end. So I will do it again. Now, guys, let's discuss this one. Okay. I understood how to solve questions based on this for the first time. Thank you, sir. You're welcome. You're welcome. Okay. Z test is different. Okay. I will tell that also. Don't worry. I'll not leave any single thing, guys. I will tell you each and everything. Okay. So this session will be uploaded on the YouTube. That's why it's recorded. So we'll not deviate from the topics. Okay. If you want to check the incidence of the deafness caused by the noise, office workers and factory workers after 1 year, which type of study will be conducted? कौन सी study करोगे? Which study you will do? Cohort. Which study you will do? Cohort study, guys. Okay. So incidence is checked in which type of study, guys? First hint, incidence and relative risk. They are checked in which type of study? Cohort study. That is forward-looking study. That is from cause to effect. That is from cause to effect. Are you getting my point, guys? Okay, if I write about cohort study, सबसे पहले what I will write, guys, it is also called as forward study. It's also called as forward study. It's also called as prospective study. It's also called as prospective study. That means I'm going forward. For example, I'm telling you guys, you learn all the 19 subjects well. Are you getting my point? You are learning all the 19 subjects and then I'm studying out of which of the following will crack the radiology or medicine in AIMS. So I'm studying on you guys. I have to wait for the outcome. है ना? First you will read all the 19 subjects, है ना? Then you have to wait. Okay, I will see the outcome. Okay, simple example, 10 people are smoking. Okay, then I will wait for them. One, they will have a lung cancer. But for those lung cancer, I need to ask them for the follow-up, yes or no? Okay, based upon an immunity level, some will have cancer 5 years, some will have after 10 years, some will have after 15 years. So their follow-up is needed. That means this is a very long study. But compared to the case control, what effect and disease, cause and effect, risk factor, everything is present. Do you need a follow-ups over there? No. That is why that is a fast study. That is a fast study and inexpensive study. But cohort is expensive. You have to wait. It is a slow study. It's a forward-looking study. Are you getting my point? Can I also call it as a risk factor to disease study? A risk factor to disease study. Can I also call it as cause to effect study? Guys, these all the other names that I'm mentioning is just to make you understand that what is the cause and what was the effect. So from cause to effect, if you're studying something, that is a cohort study. From risk factor to disease, if you're studying something, that is a cohort study. If you are going forward to the time, okay, right now you are starting the study in the 2023. So you're going forward and looking for an outcome in 2027. What type of study? Cohort study. Okay, after that, the strength of association, okay, the parameters in case of a cohort study, क्या क्या चेक करोगे? ओके, रिलेटिव रिस्क, attributable risk, population attributable risk. But this study is time consuming. This is time consuming. Okay, and also we check what? Incidence. Okay, so these all the things, incidence, relative risk, attributable risk, and par attributable risk, they are checked in which type of study, my dear students? They are checked in cohort study. So here, when you see this incidence, what is your idea, guys? I'm talking about incidence. What is your idea? I'm talking about cohort. I'm talking about odds ratio. What will be your idea, guys? Your idea will be case control. But then you have to study the whole question. Okay, then study the whole question and understand. Okay, then there will be mixed studies, cohort plus case control. You are going forward and backward. Are you getting my point? Okay, but for now, did you understand cohort? Everyone understand cohort? Yes, that is about cohort study. That is about cohort study, forward looking study. Okay, I have one table in my workbook that I have already added in this revision. In the end, all four studies, main studies, all four main studies, whether it is cohort, whether it's case control, whether it's cross-sectional, okay, or whether it is ecological study, okay, I have mentioned a one table. We'll discuss all these four studies all together to make it more clear. Okay, but step by step, we'll come to that part also. Okay, a woman in the age group of 25 to 45 years, 10th pass, married, divorced, belongs to same village community with well communication skill, skilled by the village personnel. She is eligible to work as. She is eligible to work as. है ना guys? Accredited social health activist. Full form दी गई हुई है. Okay guys, Asha. She is eligible to work as Asha. She is eligible to work as Asha. So let's discuss, guys. First, let's discuss the criteria of the Asha. पहले आशा को ही डिस्कस करते हैं. Criteria of the Asha. What is the criteria? What is the criteria? First of all, it should be female, age 25 to 45. Okay. She should be same village resident. Same village resident. It's not like, guys, a woman in Delhi, okay, she will apply for being an Asha in Kashmir. ऐसा नहीं चलेगा, guys. She should have a good communication skills. Okay, good communication skills. why she should be the same resident village? Because she will get an idea who is pregnant. Okay, then she will advise them advise them about all the vaccinations during the pregnancy that she has to take. After 20 weeks, she need to a particular checkup for what? Particular checkup for high PIH, pregnancy-induced hypertension. After 24 weeks, when there are more chances of gestational diabetes mellitus, she needs screening at that time. Are you getting my point? So she has to take care of all the things. And if in case there is an emergency, okay, she will accompany her till the hospital, and she will read the case out to the doctor. So, okay, she was pregnant like this, her child history and all. Okay, that's a particularly work for the ASHA. Other things I'll also tell you. Okay, and she should have a good communication skills. After that, guys, function of the ASHA, if I talk about function of the ASHA, if we talk about the function of the ASHA, guys, she has to do home delivery of the contraceptions. Home delivery of the contraceptions. Home delivery of the contraceptions. The contraceptions that are provided by the government. Mala and Mala D. And guys, Saheli, right? Antara. Okay, these are all the government. Okay, in Saheli. Chalo, question bata do. In Saheli, what is the drug that is used? Saheli mein kaun sa drug hai? It is SERM, selective estrogen receptor modulator. Which drug? Ornelofexine. है ना? Ornelofexine. अंतरा में कौन सा ड्रग है? अंतरा में कौन सा ड्रग है? अंतरा में कौन सा है? Depot medroxyprogesterone acetate. Guys, picture they will give the picture and tell you what is the drug inside used. Okay, SERM, ornelofexine for Saheli, and antara mein DMPA, Depot medroxyprogesterone acetate, contraception. Number one thing. Number second thing is, during my times, I remember today tablet was given. Okay, today tablet. Okay, today tablet was given. Okay, today image was given, and it was mentioned which spermicidal gel is inside this, and the answer was non-oxynol 9. The answer was non-oxynol 9. So guys, remember these things. Okay, they can give the image. For example, they can give an image of a vaginal or douche cap. Okay, vaginal diaphragm. They can ask what is the complication occurred due to this contraception. What will be the answer? What is the complication? Toxic shock syndrome. What is the complication with that? Toxic shock syndrome. So these are the questions you can expect from the contraceptions. Now they are tired of asking what? Unprotected says within 72 hours, what will be your medication? Levonorgestrel, LNG, unwanted 72, IPIL, whatever you call that, that you already know better. Or either they can ask the one more drug that can be used up till 120 hours. That is a selective progesterone receptor modulator, SPRM. What is the drug, guys? Ulipristol. Guys, Ulipristol. Is that clear? So these are the drugs you have to remember from the contraception side. Okay. So home delivery of contraception, but she will not give LNG and all. She give these copper teas, Mala and Mala D, and she gives this Antara and Saheli. Okay. Mainly this who? Asha. Okay. And she is a part of JSY, Janani Suraksha Yojana. Part of JSY. Part of JSY, Janani Suraksha Yojana. And she goes for active disease surveillance. Active disease surveillance. What do I mean by active disease surveillance or active surveillance? That these people go home to home and check for the diseases. Okay, getting the sampling of the diseases. Okay, what is passive surveillance? A patient is going to the hospital and telling doctor, I have this symptoms, and he will prescribe the treatment. That is a passive surveillance. And for STDs, sentinel surveillance. So active, for what disease she will go for active surveillance, my dear students? She will go for TB. Okay, RK39 dipstick test is done in which condition, guys? Leishmaniasis. And when I was discussing this leishmaniasis, the heading of the question clearly mentioned that the Asha went to the village home by home. Okay, so leishmaniasis, and also for the filariasis, What is the test you do for filariasis, guys? Membrane filtration test. What is the test for this? Sentinel SX John is for the sexually transmitted diseases. Okay, so leishmaniasis, guys, what is the test? RK39 dipstick test. Okay, LD bodies done, and L-amphotericin B will be the drug of choice. For filariasis, I repeat, what is the test? Membrane filtration test. Okay, you also go for PBS. And what is the drug that you give, guys? There's a triple therapy of an albendazole, ivermectin, and diethyl carbamazine. Is that clear to you? Is aid therapy, ठीक है ना? Okay, and the agents, you already know which area, Bancroft and Bruggia Malai. Not gonna go deeper that. So that was all about what, guys? Asha. Now, guys, let's discuss one by one. Okay, the village workers. What are the village workers? We have Asha, we have Anganwadi worker, we have traditional birth attendant, and we have village health guide, and we have village health guide. All these are at which level, guys? Village level. All these are at which level, guys? Village level. Again, the question in the NMCA, out of which of the following is not at village level? What was the answer? If you are doing the PYQs, answer me. इसमें answer क्या था, guys? ANM. You have been through these questions, guys? Yes. So these are all what? Grassroots level workers or the village workers. The location of the traditional birth attendant, guys, village. Okay. If I talk about population, guys, it's 1 per 1 village. It's 1 per 1 village. Education, guys, not required. Education is, guys, not required. Education is, guys, not required. The training duration is for how many days, guys? 30 days. Training duration for how many days? And it's trained by multi-purpose worker female. It's trained by multi-purpose worker female and medical officer. And medical officer. Very good. Then if I talk about village health guide, guys, also location is village. Also location is village. It's 1 per 1,000. It's 1 per 1,000. The education you should have 6th pass. Okay, guys. And training she has for 200 hours. How many hours training she need? 200 hours, or we can call how many months, guys? 3 months or 3 months. And she's trained by medical officer. Who is medical officer? Simple MBBS. Medical officer. Then, guys, Asha. Again, village. The population for Asha is? The population for Asha is? Yes, very good. It's 1 per 1,000 or 2 per 1,000. The population of Asha is 2 per 1,000. Yes, now it's 2 per 1,000. Okay, it's 2 per 1,000 new. And before it was 8th pass standard, but now it's what? 10th pass. Now it's 10th pass. And she have how many days training, guys? 23 days training. And who will train, guys? Who will train her? Anganwadi worker. Okay, multi-purpose worker female and medical officer. Guys, I have marked it in the red color. Asha, please remember. Then the last, guys, Anganwadi center, guys. She's at what center? ICDA center. Okay. And population for plains 1 by 400 to 800 for plains. For plains. But for hills 1 per 300 to 800. For hills. Okay. What should be the education, guys? 12 months. She should be education, sorry, she should be 12th pass. She should be 12th pass. But 4 months should be the training period. And she's trained by project officer. She's trained by project officer and community development officer. Sorry, you can mention a project officer or community development officer. Okay, community development project officer. Okay, so that was all about the Anganwadi worker. Okay, so Asha, guys, remember 25 to 45, same village, good communication skills, either married or divorced. Okay, Asha criteria, 10th pass, 23 days training working, 2 per 1,000. That's it. Is that clear, guys? These all the workers. Everyone clear? Yes, sir. Can we go ahead? Yes. Yes. In which stage of the demographic cycle in India is currently? कौन सा stage है? It's again the PYQ. Which stage India we have? The answer is C, late expanding stage. The answer is late expanding stage. So let's discuss, guys, phases of demographic cycle. Let's discuss phases of demographic cycle. What is high stationary, guys? High means everything is high. That means birth rate very high, death rate is very high. When birth rate is high, death rate is high. Both are high. Okay. What will happen to the population? It will be stationary. What will happen to the population, guys? Stationary. Are you getting my point, guys? Both the things are equally increased. It will be stationary. Then we have a phase 2 called as early expansion. What will happen to the birth rate in early expansion, guys? Birth rate is very high. Okay, but the death rate starts declining. The death rate start declining. The death rate starts declining. And what will happen to the population size, guys? It will start, the population size will start increasing. The population size will start increasing. Now in the late expansion, okay guys, what will happen to the birth rate? It will decline. Birth rate will decline and death rate will continue decline. The population will be increasing, but very slow rate. But at the slow rate. And India is in which stage, guys? Late expansion. That means birth rate is declined, but death rate is continuously declining. So we have an increase in the population, but at the slower rate. Okay. Then low stationary. Everything is low. That means very low birth rate. That means low death rate, and population is stationary. Okay, guys. Then the reversal is birth rate is almost zero, and deaths are just natural death, and population will be decreasing. Okay, guys, population will be decreasing. So that's the phases of demographic cycle, guys. Again, important one. Again, the important one. So India is in which stage, guys? Late expanding stage. If I talk about census, guys, census is done after every 10 years. Okay. First census was done in 1871. Okay. It's under Ministry of Home Affairs. It's under the Ministry of Home Affairs. Last census was done in 2011. SRS is done after every how many months? Sample registrations after every 6 months. After every 6 months. Okay. You have to get them. You have to. Okay. Death registration in how many days? Death registration. Death registration. Death registration in how many days? 21 days. 21 days. 21. Birth registration. Very good. Marriage registration. If you have to register that marriage certificate, if you have to register, how many days, guys? Okay, now if the baby is born outside the India and then they land back to India, after how many days they have to register? Within 60 days. Excellent. You all know this. Within 60 days. Okay. Now, guys, in a train accident, there were 74 dead, 4 were severely injured, 15 moderately injured, 22 mildly injured. Color coding in the triage from highest to lowest category. From highest to lowest category. From highest to lowest category. What will be your answer, guys? What will be your answer? The answer is RYGB. Red, yellow, green, black. So first of all, guys, it is called as which system? Triage system. What is triage, guys? It's segregation of the patients based on the chances of survival. Okay, we are segregating the patients based on chances of survival. Okay, if I talk about red color, अगर red की बात करूं, if I talk about red color, it's high priority. It's high priority. That means they need a life-saving surgeries. They need life-saving surgery. Within how many hours, guys? Within 0 to 6 hours. Within 0 to 6 hours. If I talk about the second color, guys, yellow. Okay, if I talk about yellow, in yellow, guys, we have medium priority. In yellow, we have medium priority. Okay, so they needed within 6 to 24 hours. Then we have green, given low priority. Green, given low priority. Low priority. They are ambulatory patients. And guys, the last one, black. That is the least priority you will give. Least priority you will give. They are already dead or morbid patients. Dead or morbid patients. Is that okay, guys? So this system is called as triage. This system is called as triage. Okay, what is a triage, guys? Segregation of the patients based on their chances of survival. Is that clear? This was a simple one. Which of the following does not show iceberg phenomena? Which of the following does not show iceberg phenomena? Which of the following does not show iceberg phenomena? What will be your answer, guys? Very good. The answer is rabies. The answer is rabies. Okay, so let's discuss, guys, iceberg phenomena. Okay, if I discuss the this is the iceberg phenomena. Okay, the part that we can see are the visible cases that are clinically diagnosed and confirmed. Okay, the visible cases in the iceberg phenomena is the part you can see, but the part that is submerged in the water, that is submerged in the water, these are what, guys? This part is what? Hidden cases. This part is hidden cases that are asymptomatic. Okay, that are undiagnosed, that are deliberately ignored. Okay, and then this water, this surrounding water is what? Healthy population. Surrounding water is healthy population. Okay, these are the hidden cases. Surrounding water is healthy population. And this line, the demarcation line, it is a demarcation. Okay, this line, it's a demarcation between apparent and non-apparent cases. Now, diseases between two apparent and non-apparent cases. Yes, exactly. Now the diseases that shows the iceberg phenomena. What are the disease that will show? What are the disease that are hidden, ignored? All HIV, malaria, typhoid, polio, diphtheria. And what are the disease that does not show? Rabies, rubella, tetanus, and measles. Tetanus and measles. So let's discuss these diseases fast. Is that okay, guys? I will ask you guys a question directly that we have discussed in the class. Okay, for the rabies, what are the inclusion bodies we have in rabies? What are the inclusion bodies we have in rabies? What? Negri bodies. What is the first site you will see these Negri bodies? First site, hippocampus. Very good. First site is hippocampus. Guys, now tell me the schedule of the rabies. Now you already know we have discussed the grade of the bites. Grade 1, grade 2, grade 3. Grade 1 dog bite is simply licking. Grade 2 is scratch, but grade 3 is fully bleeding. Okay. Now you have a patient coming to you. He's not vaccinated. Now he wants the vaccination for the rabies. Okay. What is the schedule for him? What will be your schedule for him? For non-vaccinated person? What will be your schedule, guys? What will be your schedule? Yes, Very good. What will be your schedule, everyone? We have already discussed multiple times. Yes, 0, 3, 7, 14, 21 or 28. Now, if the person is already vaccinated, okay. Now, what will be your schedule, guys? If the person is already vaccinated, 0, 3. Okay, guys, what will be schedule? 0, 3. Only 2 doses if he's already vaccinated. Yes or no? Yes. Yes, guys. That is a schedule of rabies vaccine. Then more precisely, we have SN regime and Thai regime, intradermal and intramuscular. Go back to your notes and revise that schedule. But more common, this is the one you have to remember. Okay. Yes, 111. Okay. Now tell me about the rubella. About the rubella, we have discussed in multiple times, guys. About the rubella. What is the triad for rubella first? What is the triad for rubella? CCD. C for cataract, C for congenital heart defect, D for deafness. One C is, yes, the question, most common cardiac defect, most common cardiac defect is patent ductus arteriosus. Most common cardiac defect is patent ductus arteriosus. Is that clear? Rubella. Measles, we already discussed complex spots, vaccines, strains, है ना? Treatment, 3Cs, agents and all. We discussed, है ना? SSP, complications and all. Then about the HIV. About the HIV, guys, tell me what is the single best test that you will do for HIV? What is the single best test you do for HIV? Western blot. What is the single best, guys? Single best, if I ask, Western blot. What are the 3 drugs you will start post prophylaxis? What are the 3 drugs in HIV you will start with the post prophylaxis, guys? Post prophylaxis. Tenofovir. Yes. Entrastadabine and doglutraver. Very good. Entrastino, entrastadabine, and doglutraver. What are the 2 drugs you will start in the newborn baby? Zidovudine and nevirapine up till 6 months. Right? Zidovudine and nevirapine. Is that okay? Is that okay? Minimum duration of 6 months, 6 weeks. But up till 6 months you can give. Is that okay? Nevirapine and zidovudine. What else in the HIV we have discussed, guys? Yes, you already know incubation period is 10 years. Okay. It's HLTV1 and all. Those are the different other things. Opportunistic infections we've already discussed, guys. CD4 count between 200 and 200. We'll have pneumocystic gyrovasa. We have cryptococcal meningitis. Okay. CD4 count less than 50. We'll have CMV retinitis. है ना, guys? More than 500, no opportunistic infection will take place. Yes or no? Between 100 or less than 100, we'll have toxoplasmosis. Right? So that was all about HIV. Malaria, guys, malaria is coming. We'll study the malaria treatment. Okay. And what are the diagnostic tests? Malaria is coming. Okay, guys. Done. This much is enough. Clear? For child HIV treatment. Zidovudine and nevirapine. Zidovudine and nevirapine. Choose the incorrect statement in given table. ELISA is also used. I said single best. We have also P24 antigen, ELISA and all. I was talking single best is Western blot. Okay. Which of the following, choose correct statement in given table for the vaccine strains. What will be the incorrect statement, guys, here? What will be the incorrect statement here? Rubella, that is Oka. Rubella Oka. Oka is for varicella zoster. Varicella zoster or chicken pox. And it's in the small age, we call it chicken pox. But it's inside, then coming out at the adult form, we call it as shingles or varicella zoster. Okay, rubella, guys, or varicella zoster. Yes, guys, let's discuss these all the strains of vaccines. Okay, you tell me, guys. Okay, what is the vaccine? What is the strain for BCG? It's Danish 1331. For yellow fever, we have 17D. For Japanese encephalitis, if you have live, it's SA 14 14 2. If you have killed, it's Nakayama. Rotavirus, it's R1X 4414. Yes, 4414. For influenza, For influenza, it's A72009 caliph. What is drug of choice for influenza? Oseltamivir. What is drug of choice, guys? Oseltamivir. Number one thing. Number second thing is oseltamivir's mechanism of action is neuroaminidase inhibitor. Guys, neuroaminidase inhibitor. Then we have paramavir or zaramavir for influenza as IV as inhalational treatment. Influenza. Which of the following condition will change continuously strains due to the genetic shift or genetic mutation? Influenza. Okay, guys. All the objectives I'm discussing, whether it's from pharmacology point of view, whether it's on PYQ, whether it's anything. Okay, influenza. Don't miss PYQs. Okay, PYQs तो गलत करने ही नहीं है. Then for measles, Admonster Jagrave. Guys, don't mind handwriting. I'm writing it fast. Okay. You already have my main workbook. Mumps, Gerelin. Mumps is Gerelin. Okay, guys. Chickenpox. Chickenpox is Oka. Chickenpox is Oka. Okay. Anything left, guys? Yes, rubella. Rubella, just remember RA27-3. RA27-3. These are all the important vaccine strains you have to remember. Is that clear? Is that clear? In notes also same. Exactly. I am the one who made that workbook. I am the one who will remember the things. The person is same. Is obvious Essex John. Okay. Rubella. Is that okay? Clear? Okay. All of the following constitutes demographic process except. All of the following constitutes demographic process except. We have 5 demographic processes. What is the answer, guys? Which one is not there? Answer is D. Morbidity is not there. Even in my notes, I have mentioned clearly morbidity. They will ask the question. Okay, guys. So what are the 5 demographic processes? Okay, you have mortality. You have mortality. You have marriage. You have marriage. You have migration. You have migration. You have social mobility. You have social mobility. And the last one you have fertility. These are the 5 demographic processes, but morbidity is not mentioned. Okay, guys. Then indicators of demography, if we'll discuss, guys. Please go through the notes, guys. Indicators of demography. I'm telling you, it is a question. Okay, guys. Indicators of demography. Okay, guys. What are the indicators? Go to check out the formulas, guys. You already know, guys. If I talk about first one, crude birth rate. Crude birth rate. Okay, guys. Number of live births upon mid-year population. Mid-year population कब लेते हैं, guys? ये भी क्वेश्चन आया था MCI में. Mid-year population कब लेते हैं? What is the date? 1st of July. Mid-year population on 1st of July. CBR you will check for crude death rate, number of deaths upon total mid-year population multiplied by 1000. You will check for general fertility rate. You will check for general fertility rate. Okay, total number of live births upon total mid-year population and the reproductive age. Okay, you will check also total fertility rate, okay, and gross reproduction rate. In gross reproduction rate, guys, it's a girl child. G for gross, G for girl child. Okay, and the last one, NRR, net reproductive rate. NRR, net reproductive rate. Go through these formulas, guys. They're all important. Okay, they're all important. Go out, find these formulas that are indicators of demography. Okay, already mentioned in the workbook. Can we go ahead? Okay, 5 demographic processes: mortality, marriage, migration, social mobility, and fertility. The Alma-Ata Conference 1978 was conducted with a theme to discuss on the primary and essential healthcare of a country. All of the following are the principles of primary healthcare, except. Yes, it will be uploaded on the YouTube. What will be your answer, guys? What will be your answer? Answer is B, appropriate policy. But in the real, what is it? It is appropriate technology. And guys, it's appropriate technology. So let's discuss, guys. Let's discuss first principles of healthcare system. The first is equitable distribution. Equitable distribution. Okay. Second is community participation. Community participation. Then intersectoral coordination. Then intersectional coordination. Intersectional coordination. And the another one is appropriate technology. Appropriate technology. Okay, guys. Appropriate technology. Guys, they can also mention inappropriate technology. है ना? They can also mention what? Inappropriate technology. Though that is not in a components. Okay, guys. So here they mention appropriate policy, but appropriate technology is the answer. Either they can mention inappropriate technology. So remember this, okay? Multiple times I have seen the question related to inappropriate. Okay. Then the elements, if I talk about the elements of healthcare system, okay? E is for health education. Okay. E is for health education. So E for education. Which education, guys? Health education. Okay. L for locally endemic disease. Locally endemic disease. Locally endemic disease. E for essential drugs. E for essential drugs. M for mother and child care. Mother and child care. What is it? MMR currently, guys? Remember, MMR currently is 97, but the goal is less than 70 as per 2030. Okay. ये याद रखना. Okay. This was a question this time, guys. As per SDG goal 2030, what should be MMR, guys? Less than 70, but the current MMR is 97. Current maternal mortality rate is 97. Mother and child care. Okay, guys. E, just remember immunization. Immunization. N is nutrition. N is nutrition. T is treatment of common diseases. T is treatment of common disease. And S is safe water supply and sanitation. Safe water supply and sanitation. So these are all the elements of the primary health care. These are all the elements of the primary health care. Is that clear, guys? Health care system of India and the principles of the primary health care. Okay, the next question, guys. A case control study is a type of observational study in which two existing groups differ in outcome or identified and compared to on the basis of some supposed causal attribute. All of the following are the advantage of case control studies, except this is the main part of the question. Just answer me from the above one. All of the following are the advantages of the case control study, except that is useful in rare disease. Yes. That is inexpensive. Yes, I told you. No follow-ups. Odds ratio can be calculated. Yes. Relative risk. Relative risk in which study, guys? We have discussed already. Relative risk in which study? Cohort study. So what is the answer? A relative risk can be calculated. Relative risk can be calculated. Is that clear? Is that clear, everyone? Yes, sir. Yes. Okay. So let's discuss in a very easy form, guys. Okay. These 4 studies. You will answer me. You already know this. So what is the direction of the cohort study? What is the direction of the cohort study? Forward, backward, at point. It's a forward study. Case control study is a backward study. Then cross-sectional study, no forward, no backward. It's done at point. At point. And ecological study also at point. Okay. If I talk about importance, guys, first followed by second, third, then fourth. Out of all the studies, which one is the best one? Meta-analysis. Remember, guys, meta-analysis, objective. Meta-analysis is a combination of all these studies. You might have gone through that triangle table. On the top, it is meta-analysis. Yes. Okay. The unit of the study is individual. Okay. Individual. But here, ecological study will tell us about the characteristic of the population. So the unit of study will be population. Unit of study will be the population. Okay. What are the parameters that you check in the cohort study? You go for incidence. This is the main thing. Incidence, relative risk, population attributable risk, and attributable risk. Okay. In case of case control, you go for odds ratio. Cross-sectional, you check for the prevalence. So whenever you see prevalence of disease is a parameter, so you will go for the cross-sectional study. And here it will is a population characteristic. Is that clear, guys? Okay. Short form of all these 4 studies, guys. We have, if you have gone through the notes, guys, first of all, distribution with the time, place, and person. Okay. Then we are making a hypothesis. When we are testing these hypotheses, then these studies are coming. Yes or no? You might have recalled all those things, guys. Okay. Now tell me, case is a unit of study for case or patient. Case or patient is a unit of study for case or patient is a unit of study for case or patient is a unit of study for case or patient is a unit of study for RCT. Very good. It is for RCT. Randomized control trial, RCT. Okay. Now the question, guys, a 3-year-old baby was brought to the hospital with the complaints of fever, severe diarrhea, and abdominal pain and vomiting. On history taking, mother revealed that the child was vaccinated recently, and examination reveals sausage-shaped lump on palpitation. Which vaccine was likely given to the child, which has led to those adverse events? So intussusception. What is your diagnosis, guys? Sausage-shaped lump is a diagnosis of intussusception. So, guys, diagnosis is intussusception. Okay. So intussusception is an adverse effect of which vaccine? Rotavirus vaccine. It's a side effect of which vaccine, guys? Rotavirus vaccine. Is that clear? Rotavirus vaccine. So, guys, let's discuss the adverse effects. Okay. Ideal observation after the immunization, 30 minutes for the child for these adverse effects, guys. You have to continuously monitor. The paralysis is a side effect of which vaccine, guys? OPV. Paralysis is a side effect of adverse event of which vaccine? OPV. Hypersensitivity reactions and the shock. That is for hepatitis B. Toxic shock syndrome. Measles. Edmonds-Zagreb. Toxic shock syndrome. Edmonds-Zagreb. GBS. Killed influenza. Intussusception. Rota. Okay, guys, in intussusception, which color stools we have? Red currant jelly stools. Hai na, guys? Which sign? Target sign or donut sign. Intussusception. Right, guys? Target sign, donut sign, red color jelly stools. Okay, they're all in case of an intussusception. Okay, sausage-shaped lump. Okay, febrile seizures with measles. Persistent crying. That is which vaccine? Pertussis vaccine. That is which vaccine? Pertussis vaccine. Thrombocytopenia. MMR. Thrombocytopenia. MMR. Neurological complications. Diphtheria, pertussis, and tetanus. And miliary TB with BCG vaccine. Is that okay? That was all about the adverse effect of these vaccines. Okay, so clinical case will be given and they will mention that the patient is reveals that there is a sausage shaped lump on the palpitation. Diagnosis is intersusception, and this is adverse effect of which vaccine, guys? Rotavirus vaccine. This is adverse effect of which vaccine, guys? Rotavirus vaccine. Is that clear? Clear to everyone? Okay, next question. Third generation IUCD. Third generation IUCD, intrauterine copper devices. Third generation of the following. Which IUCD is the third generation, guys? That is D. Mirena. Okay, guys. Mirena or the hormonal based IUCDs. Right, guys? So let's discuss these IUCDs, guys. Contraceptive devices. First of all, guys, the first generation. First generation. What are the examples of the first generation IUCD, guys? You have Lippel's loop and Grafenberg ring. You have Lippel's loop and Grafenberg ring. The second generation that are copper containing. Second generation that are copper containing, guys. What are the examples? You have copper T380A, okay, and copper T200. Copper T380A and copper T200. And what is the mechanism of action, guys? Mechanism of action, guys, of first generation. There is aseptic inflammation. There is aseptic inflammation there, okay, guys. And these macrophages will eat these sperms with the help of phagocytosis, guys. That was it. But first generation are not used then, okay? It's very old, guys. Then second generation, guys, copper containing, they will prevent what? Fertilization. They will prevent fertilization. They will prevent fertilization. Then if I talk about third generation ICD, that are hormonal ICDs containing LNG, hormonal like Mirena. Okay, guys, what is an example, guys? Mirena, LNG20. Okay, so they will work by inhibiting the ovulation. Inhibit ovulation and will make cervical mucus thick and cervical mucus thick. Once cervical mucus will be thick, it will be difficult for sperm to travel. Okay, then further preventing the fertilization. And the fourth generation we have FlexiGuard. Fourth generation we have FlexiGuard. Okay, guys, and also the mechanism of action is prevent fertilization. Prevent fertilization. Now, guys, fastly recall, what if there is a pregnancy? What if there is a pregnancy and IUCD in situ? First of all, you have to remove the IUCD. If you are not able to locate, go for X-rays, go for MRI or hysteroscopy also if needed. Take out the IUCD and ask the patient if she want to continue the pregnancy. Advise her that there are 50% chances of abortion. Okay, if she doesn't want to continue the pregnancy, go for MTP, guys, depending upon the weeks. Okay, go for MTP. Which two drugs will use, guys? Mifepristone and misoprostol. Mifepristone as antiprogestin will kill the fetus, and misoprostol as prostaglandin will expel the fetus out. Okay, and one more thing, if there is a IUCD inside the uterus, how do you will remove? How you will remove inside the uterus, guys? Inside the uterus, you will go with the hysteroscopy, and outside the uterus, you'll go with the laparoscopy. If the IUCD is outside, laparoscopy, inside, hysteroscopy. Is that clear? Okay. Then questions that the duration of this duration of copper T380A lifespan is how many years? 10 years. Okay. If I talk about Mirena, guys, lifespan is 5 to 7 years. Lifespan is 5 to 7 years. Already discussed, guys. What are the next step? That if you have a pregnancy while IUCD in situ. Okay, guys, done. And they can mention that IUCD was found to be outside the uterus. What will be your next step? Okay, that are the cases. We have already discussed that. Pictures of contraceptions, guys. Let me tell you some pictures of contraception that we have to discuss. Pictures of copper T380 and yes, here we have. See, guys, this is a female condom having 2 rings, male condom with 1 ring. This is a complication of the diaphragm or the douche cap. toxic shock syndrome. How do you use? 4 to 6 hours prior to intercourse and after 4 to 6 hours after the intercourse, take it out. Okay, these are the vaginal sponge or the foam tablets. And this was the question asked: what is the spermicidal gel that is used? Non-oxenol 9. Non-oxenol 9. This is the, guys, Mirena. Okay, with a thread, Mirena. This is a copper containing IUCD, second generation, having a lifespan of 10 years. And this is a Lippel's loop. Which generation, guys? Oldest. It is a first generation IUCD. Is that clear, guys? Is that clear? So that was all about what? That was all about the contraceptions. And this I've already discussed. Saheli, we have SERM there. Which SERM, guys? Ornello vaccine. And Antara, we have which one? DMPA. And this DMPA, medroxyprogesterone acetate, we also use in which gynecological condition, guys? Endometriosis, so that there will be a atrophy of the endometrium. So that there will be a atrophy of the endometrium. Is that clear? Coming back to our own topic, guys. In disaster management, or all true except. In disaster management, or all true except. In disaster management, or all true except. In disaster management, all are true except. The answer is C. Response in pre-disaster phase. Response is pre-disaster or post-disaster? Response is post-disaster. Okay, guys, in pre-disaster, you have prevention and preparedness. This is a pre-disaster. And after the event, that is a post-disaster. After the event, things are post-disaster. Okay, in pre-disaster, guys, you have mitigation and leading preparedness. Okay, post-disaster is response and rehabilitation. Response and rehabilitation. If I talk about the ministry, which ministry comes this disaster? Home Affairs. Ministry of Home Affairs. Okay, and NDMA, it's National Disaster Management Authority. National Disaster Management Authority. Okay, and the chairperson is Prime Minister. So, guys, you have to remember response and recovery are the post-disaster, and prevention and preparedness is a pre-disaster phase. Okay, after the disaster, okay, which vitamin deficiency is there after post-disaster? Vitamin A deficiency. And which infection? Gastroenteritis. Remember this, gastroenteritis. Okay, so disaster management, it is post-disaster phase. You have to remember it is post-disaster phase. Okay, clear, guys? Can you move to the next question? Okay, we are just left with 2 questions and done. Okay. A 26-year-old male presented with the fever, chills, night sweats, and diarrhea. The physician is suspecting malaria and he sent a blood sample for the diagnosis, and dipstick test was performed for the rapid diagnosis of Plasmodium falciparum. It's based on which protein? It's a PYQ directly from the NEET PG, guys. Which protein do you have? Which protein, guys? Good, histidine rich protein. Which protein, guys? Histidine rich protein. Okay, so guys, let's discuss about diagnosis first. Let's discuss about the diagnosis of the malaria. So first of all, what do we do, guys? We go for PBS examination. Yes or no? PBS examination. We prepare 2 slides. How many slides we prepare? 2 slides. Who will prepare these slides, my dear students? Multi-purpose worker, male. So what are these 2 slides he will prepare? He will prepare thin and he will prepare thick. Okay, thin will tell me about the species of malaria. Thin will tell me about the species of malaria, whether it's ovale, whether it's vivax, whether it's falciparum. Yes, okay. And thick will confirmation. Thick will tell me about the confirmation of the malaria. Okay, guys, thin and thick. Then, guys, we have a rapid diagnostic kit. We have a rapid diagnostic kit. We have a rapid diagnostic kit. Okay, antigen is detected. Okay, antigen detected kit. Okay, and which protein we use? HRP2. That is histidine rich protein. Histidine rich protein. We also check LDH levels. Is that okay? Now, if we talk about agents, you already know, guys. Agents में से most common in India is most common in India is Plasmodium vivax. Most dangerous is falciparum. Very important question that they ask, guys, treatment. Remember, guys, if it is Plasmodium vivax, then chloroquine in all the states. If vivax, remember, guys, if it's Plasmodium falciparum, then two conditions. Northeastern states, you will go with the ACTL, that's artemethyl lumefantrine and primaquine, and other states you will go ACTSP. You will add artesunate and sulfadoxine. Is that clear? ACTL, ACTSP, malaria. What are the diagnoses? Peripheral blood smear. We go for the histidine-rich protein. We go for LDH levels and thin and thick blood smear. Thick will tell me the species, thin will tell me the conformation. Most common is vivax and most dangerous is falciparum. And which protein, guys? Histidine-rich protein. Is that clear? Guys? Can I move to the next question? Yes. Okay. And we have then incidence, guys. Annual parasite incidence, API, that is for the new malaria cases. And the best indicator of the recent malaria transmission is infant parasite rate. Okay, guys, infant parasite rate. Okay. Now this one, a woman who is lactating came to the OPD 6 weeks after the delivery of her checkup and get advice for contraception. She wants advice for contraception. Which of the following is not advised? So the patient came to you, she is lactating the baby. So which of the following you will not advise? Combined OCP. What you will advise, guys? Progesterone, contraception of choice in lactation is progesterone only pills. POP, progesterone only pills. Okay, guys. So first let's discuss the OCPs with cancer. Okay, let's discuss OCP with cancers. Okay, either they will increase the risk of the cancers or they will decrease some cancers. Either they will increase some cancers or either they will decrease some cancers. They will increase what cancers, guys? Increased chances of breast cancer, increased chances of cervical cancer, increased chances of hepatic adenoma. In surgery you have studied, or hepatic hemangioma. These are all the cancers, guys. These are all the cancers that are increased with the intake of OCPs, increased with the intake of OCPs. Okay, breast cancer, cervical cancer, hepatic adenoma, or hepatic hemangioma. So the liver patient, all the patients that are having a liver disorders, they cannot take OCPs. Why? Because they increase such cancers. Okay, it will decrease which cancer, guys? Endometrial cancer. It will decrease endometrial cancer, it will decrease ovarian cancer, and it will decrease uterine cancer. These all the cancers OCP will decrease. But my dear students, endometrial cancer, it's increased by a drug called as tamoxifen. Used in the breast cancer. Instead use which drug, guys? Raloxifene. Instead use raloxifene. The indication of raloxifene is also in osteoporosis. But the drug of choice for osteoporosis is bisphosphonates. Okay. Then if you have a severe osteoporosis with the -2.5 SD of bone scan, you go for the teriparatide or a rank ligand inhibitor, denosumab. Is that okay? And pregnant and the ladies before the menopause, you prescribe estrogen. है ना guys? So that was all. Endometrial tamoxifen and raloxifene. Is that clear? Is that clear? Is that clear? OCPs and their side effects. Yes. Okay. Now, guys, last three these charts. All the disease along with the agents and vectors are confined in the table, guys. You tell me. I will tell the disease. You will tell me the agent and vector. Okay, guys. Okay. First of all, guys, let's write brucellosis. In brucellosis, there is a two tests in brucellosis. Remember, guys, milk ring test and rose Bengal test. Write it down. Milk ring test and rose Bengal test are done for which condition, guys? Brucellosis. Okay. Okay. What is an agent? B melitans. What is an agent, my dear students? B melitons. Okay. And the vector is unpasteurized goat milk. Guys, methods of boiling of the milk, pasteurization, Halter-Wald method. Okay, then cauliflower count we check. Then we go for the methylene blue test. Okay, check those uh, tests in the workbook. Okay, brucellosis, B melitons, unpasteurized goat milk. If I talk about KFD, what is an agent, guys? Group B arbovirus. Group B arbovirus, and the vector is hard tick. And the vector is hard tick. And the vector is hard tick. This group B arbovirus, it is also for yellow fever. Yes or no? This is also for yellow fever. Yes or no? And what is the vector? Aedes mosquito. Aedes mosquito. If I talk about leptospirosis, leptospirosis. If I talk about leptospirosis, that is due to what? Rat urine, है ना guys? Leptospirosis. Okay, what is an agent? L interrogans. L interrogans. And the vector is, guys, and the vector is rat urine. And the vector is rat urine. If I talk about echinococcus, okay, the agent is echinococcus granulosis. Echinococcus granulosis. The vector is dog. The vector is dog. Echinococcus granulosis causes, guys, hydrated cyst having a water lily sign on USG. The classification for that is Gabri's classification. And how do you treat, guys? Pair therapy. Okay, percutaneous aspiration, guys. Then initiating the scolitical agents like albendazole, guys. And again, you have studied that pair. Just remember, guys, treatment is albendazole, echinococcus granulosis, water lily sign. That's it. Okay, for the hydrated cyst. This is a cyst of the liver. Which liver lobe mainly? Right lobe of the liver. Okay, echinococcus. Then also, guys, we have tenaces. Okay, it can be due to the Tinea solium or saginata, depending whether the vector is pork or beef. Whether the pork or beef. What is the drug of choice for tenaces, guys? Praziquantel. What is the drug of choice for tenaces? Praziquantel. Okay, guys, praziquantel. Okay, then we have echinococcus. Then we have plague. Okay, in plague, what is the agent, guys? Yersinia pestis. Yersinia pestis. Okay, and the vector is rat flea. Okay, most severe form of plague is bubonic plague, है ना? We have two types, then bubonic plague and pneumonic plague, है ना? So bubonic is most severe one. Okay, then, guys, bubonic plague, is that clear? Then malaria. Okay, then malaria. Okay, what is the agent, guys? Plasmodium. And vector is Anopheles female. If I talk about rabies, which virus we have? Lissa virus. And what is the vector, guys? Rabid animal. Vector is a rabid animal. If I also talk about dengue, what is an agent, guys? Group B arbovirus. What is the agent, guys? Group B arbovirus. And what is the vector, guys? Aedes. Aedes. If I talk about epidemic typhus, we have Rickettsia prowazaki. Okay, and louse is the vector. If I talk about endemic typhus, we have Rickettsia typhi, and the vector is flea. And the last one, if I talk about scrub typhus, okay, we have Rickettsia sutsugumoshi. And the vector is mite. This was all about the vectors and agents. And then we have rickettsial fever. We have three. We have Rocky Mountain Spotted Fever. What is the agent, guys? Rickettsia rickettsii. And vector is hard tick. If I talk about Indian tick typhus, if I talk about Indian tick typhus, we have Rickettsia coroni. And the vector we do have is hard tick. Then we have Rickettsia pox. We have Rickettsia acari as an agent and mite as a vector. So that was all about agents, vector, agent, and vector and disease. So let's revise fast, guys. Okay, I will tell the agents, you will answer me. Okay, I will tell the agents, you will answer me. Is that okay? So tell me, guys, for the brucellosis, what is the agent? Group B arbovirus. Okay, guys, sorry. For brucellosis, what is the agent? B melitans. For KFD, what is the agent? Group B arbovirus. For echinococcus, what is an agent? Echinococcus granulosus. For plague, what is an agent? Yersinia pestis. For plague, what is an agent? Yersinia pestis. For yellow fever, group B arbovirus. Is that okay, guys? For Rocky Mountain Spotted Fever, RMSF, what is an agent? Rickettsia. Okay, very good, guys. Sutsugumoshi is for which typhus? Scrub typhus. That's for scrub typhus. So this was all about disease, agents, and the vector. In the short form, you can remember the guys. Then we are done with this rapid revision. Just around 40 questions and 40 topics we have discussed, guys. Yes, although we missed a lot of topics, but you just have to remember that all those topics are there in the workbook. They're all around, guys. Keep studying. Okay, keep solving the questions. If any doubt, you guys can just ping me on my Telegram. Wait a second, let me